Good morning, good afternoon, or good evening, and welcome back to Bariatrics and Beyond, the podcast where we talk about life before, during, and beyond bariatric surgery. So grab yourself a drink and a healthy snack, because today I want to introduce you to two of our staff members all the way from Mexico. They're going to be the ones that check you into the hospital. So please welcome Perla and Conrad.
Oh, hi guys.
Hello.
Hello, how are you guys?
Oh, we're pretty good.
That's good. What's the weather in Tijuana like?
It's kind of weird these days because there's a lot of winter, but it's freezing too.
Yeah. You see, for me, it's kind of freezing.
Yeah, it's freezing here too. It's freezing all over. I don't know what's going on. Okay, so you guys, can you explain to everybody, how long you've worked for EOC and what is your role with the company?
I'm Conrad. I've been working here with Bariatrics and Company already like 5 years. I'm 30 years old, and most of the job we do over here is to help the patients in their journey here in the hospital since they arrive until they get discharged from here.
And that's the bariatric patients, correct? Not the plastic surgery patients?
Yeah, exactly.
Perfect.
It's only bariatric patients. And, like you already said, my name is Perla. I am 33 years old. I have been working with Dr. Ortiz. This year is going to be 8 years. But as EOC, it's going to be 5 years.
So Perla, I remember you checked me into my hospital room in 2018.
I do remember you. Yes, we were.
I was like
the other hospital, and I do remember like your hair. You was on pink as always. So I do remember you.
Nothing's changed. I remember you making me feel so comfortable. It was really early in the morning. And I was kind of like scared. I'm scared of hospitals and doctors and all that. And you were like, just super chill. And you're like, you're going to be fine. And I just remember I'm like, her name is Perla. What a beautiful name. I've never heard the name Perla before. I was like, that is such a pretty name. She's so nice. So yeah, thank you for making me feel welcome. So let's explain to the patients like what to expect when they get to Mexico. So they've arrived. The drivers bring them pretty much straight to you guys. That's the first stop because they do the pre-op testing there. Is that correct?
Okay, yeah, it's a lot of what the patients experience at the first day when they arrive to the airport. The first thing is obviously they're going to see the driver that is going to pick them up. And what they need to do before going to the hotel is coming here to the hospital to do the pre-ops. They have to do the pre-ops so the intensive care doctor see the results and also evaluate them in the day of the surgery. But the first day is basically that's it. They have to come here to the hospital. We receive them and give them information about what they need to fill, all the questionnaires, all the formats over here. And then they go back to the hotel. They stay over there the night, and the next day come over here for surgery.
Mm-hmm. Yes, the first day of pre-ops, what they expect, it's have EKG done and the labs, because both things are really important to the internal medical doctor. That way they can check there everything is good to go. It's like the first phase. And because the internal medical doctor need those results and the questionnaires to see, it's like the last check-in to set it like that.
Right. So they review everything the day before and make sure everything's good to go. And don't worry if you don't hear anything. No news is good news, right? So
yes.
Yeah, so that's
that's one of the purpose to do that one day before the surgery. Mm-hmm. That way, if they see something maybe on the labs, they can do something before the day of surgery.
Mm-hmm. Right.
Yeah, there's been sometimes that patients they get a little bit stressed because they don't know or hear anything from the doctor, and that means that everything is fine. Mm-hmm. Labs and EKG comes up good. But if you hear something, a doctor is going to talk to you and explain what is need to do to be able to do the surgery. Mm-hmm. But the doctor always going to explain and talk to you before the surgery if something comes in the lab results.
Right, and that's fair. It's kind of rare. It doesn't happen all the time, but if it does, they catch it early before surgery. Okay, so day 2, they wake up and then it's surgery day. So that's when they then bring all their items in their suitcase and they check into the hospital. They're going to be there for 2 nights. So can you explain what you two do at that point to check everyone in?
Yeah, sure. Once the big day of surgery, once that the patients arrive, this is the two phases that you're gonna see once that you're arriving. Uh, like you said at the beginning, what we try to do first is try to make you feel calm, because I know there's a lot of patients that they are really, really nervous to have surgery, or they haven't had any kind of surgery before, and this is the first surgery for them. And we understand that that can make you feel really uncomfortable or nervous. So what we try to make you feel is like um you're not alone, because also we know that there's some patients that they come by themselves, so we try to help you on that. So once that you arrive here, we're going to be giving you all the information that you will be needing. If you have any question, some surgery question we can answer. There's another ones that need to be answered by a doctor, but also we can help with that. Any question that you have for you, or if you bring a companion with you, um, we give you all the information. Once that you arrive, we're gonna do give you all the information that you will be needing after before to the check into the rooms, the hospital rooms. Like I don't know what to expect once that we take you to the room. Like you're gonna find your gown, how you need to put the gown on you, if you bring compression socks or not, if that makes any difference, if you bring it or not, because we know there's some patients like to bring it. So what you need to do with the gown, what you need to do with your compression socks. Also about most of the uh, questions that the patient have is about the surgery time or surgery order. That's another thing. What we have explained to patients is that we do have an order, but we put the order just to bring the patients to the hospital. But it's not a surgery order, because
Mm.
everything depends on BMI and medical records. One of the first phases that you will be meeting also is the internal medical doctor. This is all the information that we give you once that you arrive. Um, because after that, Dr. Cordero, by the way, he's the one that check all the medical results, questionnaires, and also what the patient have sent. After that, then Dr. Ortiz can choose the order. That's one of the
Mm.
most often question that we got, because sometimes when that we start picking up to the patients to the rooms, they think that because we said your name first, you're gonna be the first one, but that's not true.
Yep, and it can change, and Dr. Ortiz will figure it out. But the one thing that we can guarantee is you will have surgery that day. So whatever
Yeah.
time
Yes.
it's going to be that day. Just hurry up and wait, basically, and pack your
Yes.
patience.
That's the first thing. And that's
Yeah.
the first thing we ask. You need to be patient, try to calm, put the gown on you, put the compression socks if
Yeah.
you bring it. And after that, well, just try to relax.
Mm-hmm.
The important thing is, and we bring the patients at that time because they need to get hydrated, not in water, but with the IV. So mainly the first day in the morning, that's what we do the day of the surgery. Explain you where you're gonna be, what you're gonna have once that we get you to the room, and what to expect after that.
Mm-hmm.
Most of the thing is being patient, because well, we need to wait for the team.
Yeah, exactly. And then so they'll be hooked up to an IV, so they're hydrated. So basically, you guys, I know for me what I did, I bought a coloring in book because I was like, I just need to kind of take my brain elsewhere, and I brought my crayons and I just colored in. But there's TVs in the room if you want to watch TV. But let's talk about the rooms, because there are some private rooms and there are some shared rooms. Me personally, I'm a people person. I'm like, I make friends. I wanna have like a surgery buddy, and I know a lot of people do enjoy having a roommate and your companions or chit chat, and it makes the time go faster, in my opinion. But other people have private rooms, but there is no guarantee, no picking or choosing who gets what. Can you explain how the room allocation works?
All right. This is kind of well. There's rooms with double beds and private rooms, but the way that we choose is basically patients when they come with family member or a friend, they ask for it and they want to be together. Obviously, we're gonna find a room to put it together,
Mm-hmm.
and that makes also their journey here in the hospital make easier because they're together. They're gonna go probably at the same time at surgery, so it's very helpful for patients that they come with family or friends. Sometimes also we have situations where you have to put patients to share rooms, and we always do it like woman sharing with another woman, and in the with companions also being females. And this is because sometimes we have a lot of patients coming here to the hospital and it's totally full, and we have to figure out how to put everyone into the hospital. And the private rooms, we have a full floor with private rooms, but those ones is totally random. When usually when patients come over here, the first rooms that we give are those ones, the one in the sixth floor, by the way. And patients get in those rooms, and the next day, because that floor is already full, we have to look for another floor, and they're going to be double beds, so we have to find out how to put patients together to be more comfortable. It's not always like you're going to get a private room for sure, but we have to try our best to figure out how to put you in the hospital.
Basically, is depending on our schedule and what is available in the hospital. Patients cannot like request a single room because sometimes even that we want to, we don't have anything available. So we need to work with what we have. But by the way, the double rooms are super big. Ours, most over there, they have good light, and also they're really comfortable. So I think there's no bad to be with another patient. And also, like we see, we have a lot of patients that they came by themselves. So sometimes we try to put them together that way they can be supporting each other.
Yeah, that's helpful.
There's a lot of things, that kind of things that we look when we are giving the rooms to the patients. But everything depends on the schedule too.
Yeah, and also patients, when we put it together to share and they didn't know each other, at the end when they got discharged from here, they're best friends, or they're
all the time.
Yeah, so
they share the Instagram or the Facebook or the phone. And once that they get back to the hotel, they like to go and get some breakfast together. So I think it's also a good opportunity to have a surgery sister.
Yeah, it's such a bonding experience. I was just there a couple of weeks ago, and I met a couple of girls that were sharing a room. And they were like, we had a private room when we started, but we kept doing our, we just kept talking to each other, and we're like, hey, can we just get a room together? So you guys change them and put them in a room together. And they're like besties. And I love that. But to be honest, you guys, allocating the hospital rooms probably sounds like an extremely hard job. Is that the hardest part of your job? Is like figuring out who gets who and what gets who and trying to please everybody?
Yes, because you know what? We try our best to make you feel comfortable and to like the room that we give you.
Yeah.
But of course, sometimes patients are not happy because, I don't know, something, and maybe we don't have another option for you. We try to, but sometimes just we couldn't do anything.
Yeah.
So
you guys, you are very compassionate, very helpful, and I think you guys do a really good job. So you do the best you can. So take it easy on them, you guys. They're trying. They're doing the best they can with what they've got. But I don't ever really hear any complaints. I hear the opposite. I hear people going, "Oh, I had like the best companion, like the best roommate, or my roommate's companion because they didn't have a companion help them." You know, so I hear a lot of good things. So that's pretty good.
Also, like today, the group of today, they were asking, "Let me know the room that you will be," because she was by herself, and they want to be like taking care of each other, you know?
Yeah, it's so nice. Yeah, that's what I love about the whole experience is like you actually, it's not just surgery, like you make friends and it's like everyone's just so cool and fun and caring. It's such a good thing. Okay, so they're all checked in. They got the gown on, they got the compression socks on, their IVs in. They're just hurry up and waiting. Surgery time comes. You guys, Dr. Ortiz comes to meet them. They're in and out before they even know it. And so basically day one is just surgery. And then that night, most people just sleep, right? Sleep the night away.
Yeah. Depending on the surgery time, yes. Because also they are, after surgery, they are given a lot of meds for pain, for nausea. And of course, depending on each patient, if they need anything extra, well, they are very drowsy and sleepy,
Right.
usually.
And every level that the patients stay on, so I believe it's like what level 3,
It's
4, 5, 6. I can't remember
we
exactly.
we have
Four.
3, 4, and 6 for our patients, but
Right.
the OR is in the first floor. So
Gotcha.
we always let them know that you're gonna be like today 6th floor, but just for surgery, they will be taking you to the first floor. Once that surgery done, recovery is done, they will take you back to the 6th floor.
Mm-hmm. And every floor that they're on, there is a nurse station on each floor. So
Yes.
the nurses are there. If you guys need anything, they're always there. They're always coming around checking. But that's basically day 1. So day 2, because they stay in the hospital 2 nights. So what does day 2 look like for them? Because they've got a drain as well. So can you explain like the leak test, the drain, the popsicles? Like how does day 2 look like?
Day 2 is kind of more easy for the patient because they already went through for the first day of nausea or tired for the surgery or the gas. But as soon as the day start, they have to do all the patients. They have to do a leak test in the morning around 9-10 a.m. is always the time, and they take you to the main lobby where the hospital has the scan for the leak test. Over there, and a lot of patients tell us that they're gonna give you a contrast.
Doesn't taste really good.
Yes, don't
Doesn't.
take contrast because it tastes horrible. And
But let's be honest, you guys, if you've ever done a shot of any kind of alcohol, it's just kind of the same thing.
Yes, just do like a
Yeah.
shot of tequila. Just
exactly.
take it and that's it.
That's it.
yes, and when you pass your leak test, you're gonna start getting your liquid diet back again. So you're gonna receive your apple juice. You're gonna have more water. If you want, you can have more broad, and that will help you a lot. That's you'll even though you're gonna be hydrated from the IV.
Mm-hmm.
Liquids are very important, and you're gonna be sipping water or juice, and that will help you a lot because your mouth is gonna be kind of dry.
That's what I was going to say. Your mouth gets dry after surgery, but you can't have a drink while your drain tube is in, right? So they've got their popsicles and they've got their apple juice, and then what does the rest of the day look like for them on day 2?
And the rest of the day 2, patients when they finish their leak test and they're gonna start receiving their liquid diet back, liquid diet again, and you're gonna have all the patients they're gonna have apple juice, water, and bag of tea in the rooms, so they can start getting liquids back. It's gonna be very helpful because your mouth is gonna be dry, even though you're gonna be hydrated from the IV.
It's different.
Yeah, it's different, and you're gonna feel way better. And like I said, that's gonna be like a 10 a.m. the leak test, and also like at midday, probably always is like a midday. The doctor is gonna go to the room and start getting drains out. That's a good starter point to get up and start walking because the drain usually start the drain kind of bother you and keep you from breathing very well. So when you remove it, you have like more energy. You can breathe a lot better, and
it's a relief once it's out. Yeah, it doesn't hurt, you guys. It's just uncomfortable, and you can't take like a huge deep breath. So once it's out, you will feel 10 times better.
That's what I think.
It is super quick. They take it like in less than a minute.
Yeah, it's super quick. You just deep breath and then they pull. I think it's like 3 deep breaths and it's out.
Yes.
Yeah.
But wait like 30 minutes after you stand up. So
gotcha.
You need to wait a little 30 minutes, and now it's going to be the time to get out of your room and start walking with the halls.
Mm-hmm.
And if you want, there's a lot of patients that they like to come to the lobby to walk, and the more you walk, you're going to feel much better. And a lot of patients, they have gas pain. The best way to get rid of that is to walk in and do your breathing exercise. All the patients, they receive a speedometer, so you can do your lung exercise. That also is very helpful because it keeps you oxygen's level normal and
with lungs.
Yes, also
Yep. So it's good to do that. And then it's like this little
With the
apparatus,
balls.
and then
Yes,
with the
one.
balls, and
Yes.
I was like, I thought you had to blow it, but you actually have to suck it.
Yes,
So
you have to look in.
yeah,
Yeah.
so do your
And
walking and your breathing exercises. It's all very important.
I always recommend to the patients the first day that they can start with that.
Mm,
Like at the beginning, the breathing exercises, and that way you can start helping your lungs again.
yep.
And once that you feel more awake and alert, you can start walking in the room. Of course, everything depends on each patient
Yeah.
because every patient react different to the anesthesia. We have seen patients that they had surgery maybe with Dr. Covarrubias at 7 a.m. and by 11 they are walking.
Yeah, that was me. I
Yeah.
was like, I put my pink
Yes.
robe on, my bow in my
Yes.
hair, and I was
I know,
fine.
and that's the first day of surgery.
Mhm.
But there's some other ones that it takes a little bit longer than that.
That was my
So,
sister Nicole. She
yes,
was
I
like, leave
remember
me
those.
alone.
Yes.
So there's just no telling.
No, of course
Yeah.
not. She's not gonna know it. But yes, that's why I always say, depending on how you're gonna be feeling, it's what you need to do.
Mhm.
You start with breathing exercises, and if you feel able to stand up, then I start walking. If you don't feel sure that you can keep stand up, it's gonna be better to keep resting and just do the breathing exercises. And as soon as you feel okay, well, then walk as much as you can.
Yeah, perfect. And then they've still got the IV in the whole second day. Is that right? Or does that come out, or when does the IV come out?
No, the IV.
Comes out the day of discharge.
Yes.
Okay,
the day
so
of discharge, you have your IV out. Probably an hour or 30 minutes before you get discharged from the hospital.
Yes, because they give the last medicines before
Yep.
to go to the hospital. So
I love that. Because you guys, here in the States, like if you have bariatric surgery, you're home that afternoon. Like some places don't even keep you overnight. Yeah. So I love that. Like you're being monitored for 2 nights in the hospital with an IV. So you're not suffering from dehydration. If you have nausea, you're getting fed the nausea medication. It's just so much better. Honestly, it really is. Because here you're in and out, and it's like fend for yourself.
And also, I guess that's why Dr. T's do it this way, because he likes to be like, even that he knows that everything is good, he likes to be checking on the patients before to send them back to the hospital. Because if anything, we have everything in here. And also, as you said, there's a nurse station in every single floor. So there's always an eye on them.
Mm-hmm.
Anything also the nurses can give them more medicines. There's some patients that once that they are walking, they feel better. Yep. But if for some reason they feel maybe really tired and they are not walking enough, maybe the gas pain is going to be bothering a little bit more. So nurses can give a little bit more pain medicine or anything. So, but that's the second day of the surgery. If they are at the hotel, it's going to be harder to be taking care about the patients, So
exactly.
I think that's why doctors like to do it this way.
Yeah, I think it's way safer too. And here's the thing, you guys, like people always say, oh, Mexico, blah, blah, blah. We hear it all the time. But our complication rate is far less than the complication rate for bariatric surgery in the USA. And that is because you are in the hospital longer. We have the world's best surgeons. Like, let's just start there. But, if anything was to arise, you are still there and it gets caught. You know what I mean? We do 3 leak tests. All of these things have been put into play so that complications don't happen. And if they do, they get caught, they're caught right away. Whereas I think in the US, like I said, you just have surgery and you're gone home. So I think, people really do need to do their research because our complication rate is far less than it is in the USA.
Yes, and also, we have the hospital nurses, but let's remind that also Dr. T's have enough aftercare physician, and they are taking care of all the patients the entire time. So Dr. Borbon and Dr. Magaña, they are always taking care of all the patients. They are visiting them, and they are also in touch with the nurses just in case that they need anything and if they need to go and see the patient again. So there's always going to be somebody taking care about you. That way you don't have to feel like you're by yourself.
Yeah. And then you go back to the hotel and you're there for another 2 nights at the hotel or another night at the hotel where there's nurses there as well checking everything and reporting back. So that's super. Every aspect is just, well thought out. which is really nice. Okay, so day 2 is done. The drain's out. They're walking. They're, maybe not feeling 100%, but, they're feeling a lot better once that drain's out.
Yes.
Then the 3rd day, it's time to go back to the hotel. So how does that process work?
The day of the discharge, basically, all the patients goes back to the hotel at 7:30 a.m. That's the time that we have the schedule with the driver.
Mm-hmm.
But patients that have gastric bypass or mini bypass, Sadie's procedure, those patients have to stay probably an hour more, 2 hours more. They have to stay until the aftercare physician come to the hospital and check on them. This is a double check routine for all the patients that have bypass procedures.
Mm-hmm.
And this is because because bypass is a longer invasive surgery. So they have to double check. It's just to prevention. And patients with gastric sleep, the discharge time is at 7:30 a.m. And like I said, probably like at 30 minutes before that, nurses, they go to the room and remove the IV. Mm-hmm. The only thing that patients have to do is start getting their luggage ready and come to the lobby to wait for the driver. They always on time. They always come really quick, and they probably arrive like at 8 a.m. in the morning to the hotel with my coworkers, Michael, Sarah, and Eric.
And then they will get you checked back into the hotel. So that's really how the hospital process works. So let's talk about companions coming to the hospital, because we have the patients and then they bring their companions. Now the companions do have the option to stay at the hospital for the night, the 2 nights, or if they want to purchase rooms at the hotel, they can go back to the hotel. I feel like, it's 50-50. Well, maybe it's not 50-50, but I feel like a lot of companions do stay at the hospital. So if they do stay at the hospital, where do they sleep?
There's always going to be a recliner for companions in the rooms. Even that maybe for some reason you have a double room, medical beds are only for patients. Mm-hmm. But there's always going to be a recliner for companions. What we recommended is to bring a pillow with you and a blanket. But if for some reason you forget it, or maybe you're too cold, nurses can help with an extra blanket for them.
Gotcha.
But we do recommend it to bring one with them.
But yeah, bring your own. It's more comfy to have your own stuff as well. But yeah, there are extras if you need a little bit more warmth, because we all know hospitals are kind of cold.
Oh, yes, more in the night.
Yeah. And you say a recliner, but those chairs, they're like the Cadillac of fold-out chairs. They're pretty decent. They fold completely flat. Like you can actually lay all the way down.
If they pull it out, also flat and looks like a bed.
Yeah, so look, it's no king size, pillow top, but it will do for the night or two, it works.
And also let's remind the purpose of the companions. Yes. They are here for support the patient. Mm-hmm. So I think we try to help them a lot, but also, if they are not that comfortable, let's remind the purpose of them. They try to make to feel comfortable so their patients. Sometimes they can get a little bit more nervous than helpful.
Yeah. So you guys, when you bring a companion, pick right, because it can be stressful if you bring the wrong type of companion that needs more assistance than you do. Really, really think about that. A good companion can either make or break your experience. So pick someone that's caring and considerate, and
but also we're gonna be taking care of the companions.
Right, exactly. So can you explain like the area where the hospital is and where can the companions eat? Because look, let's be honest, everyone checking into the hospital, they're hungry. They've been on a pre-op diet for so long, they're on a clear liquid diet, and then after surgery you don't even want to think about food. So they can't bring food into the actual rooms. So where can they eat and where can they get food from?
All right. Well, unfortunately, we don't have a cafeteria here in the hospital. They closed like a year ago, and I probably doing because they're doing remodelation in the hospital. And what the option are to get food over here is Uber Eats. There's a lot of restaurants where you can order food.
Mhm.
And there's always the taco place. It's very reliable. Here, the tacos El Gordo is like 1 block from the hospital.
Yeah. Who
In
doesn't
our
love, we have that in Vegas, Taco El Gordo. That's like
yes,
I said that in the most
it's huge
gringo
over there.
way, but we have it in Vegas. It's like so popular. But
Yes.
it's right on the corner of the hospital. So like
It's
it's like
less
an
than 10
easy
minutes
walk.
walk.
Yeah, it's an easy walk.
And in front of it also, there's a convenience store
Mhm.
called Foxo. So if they want to buy anything extra or maybe small snacks,
Yeah.
they can bring it. If the companion doesn't want to go out, because we understand that sometimes they don't want to walk
Mhm.
outside from hospital,
Mhm.
well, Uber is going to be the option.
Yeah, Uber Eats is always a
Yes.
good thing.
And the place to get to take all your food is right next to the lobby. There's like a mini hall that
Mhm.
takes you to the provisional cafeteria where the
Chairs
hospital
and tables.
put the chairs and tables, a microwave, and all the staff and companions we eat over there.
Yep.
And you have a nice view from the city over there actually.
Oh yeah, nice.
Yes, but it's kind of provisional because they're doing a lot of construction right now. But it's kind of it's very good the place. And one of the rules of the hospital is that you cannot take food to the room
Yeah.
because it's kind
The
of rude that you
smell of
eat
it
in
and
the
all
room.
of that.
Yes.
Yeah, that makes
Yeah.
sense. So if a companion doesn't want to stay at the hospital for the night, do the shuttle drivers take them back to the hotel? And then what's the last time that, they can get on that shuttle?
Yes, last shuttles are between 7:30. We said like between because we know around that time we have some plastic patients appointments, so everything depends on who's gonna be available.
Mm-hmm.
But the last driver is gonna be between 7:30. But what we do is even it's easier for the companions too. We keep them at the hospital room, and the driver go and ask them if they want to go back or not because we don't have like the surgery order, we don't know if your patient is gonna be out for the last shuttle time.
Gotcha.
So, but we keep them at the room, and also we explain them that one of our drivers gonna go and ask them if they want to go back or not at that time, just in case if they decided to go. Well, they go with them and they take you back to the hotel. If for some reason they can stay if they want to because always gonna be a recliner like we already
Yep.
explained. Or if they want to go later than that, Uber is gonna be the option.
Yeah.
By
And
the way, it's pretty easier to use over
So
here. I
easy.
think you already know because you use
yeah,
it.
I Uber all the time. And you guys, it
Yes.
is so cheap. Like you can get
Yeah.
anywhere in Tijuana from top to bottom for
Yeah.
less than $5. Like it
Yeah.
is so cheap.
And
Yeah.
also it's just one grand hotel in Tijuana. So
Yeah,
there's
you can't
way
get
to-
lost.
there's
Yeah.
nowhere.
Yeah, exactly. Well, thank you guys. I think that really explains, the process of the whole hospital because like we said, a lot of people do get nervous about that. But just personally, have some couple questions for the two of you. So Perla, you have had weight loss surgery, haven't you?
Yes, I did.
When did you have your surgery?
It was this year's gonna be 8 years ago. It was on the
That's crazy.
2017.
That's crazy. And so,
I was,
yeah, go
I'm
ahead.
sorry.
No, go ahead.
No, it was with Dr. C. Well, everyone knows him like Dr. C, Dr. Covarrubias.
I didn't know you had your surgery with Dr. Covarrubias. That's
Yes,
awesome. That's awesome.
he was my surgeon. Once that I started working with the other company,
Mhm.
he was one of the surgeons too. So he was who did my surgery.
That's
that
excellent. See, you guys, our coordinators in the States have all had surgery, and even a lot of our staff in Mexico have had the surgery too. So what do you recommend? Like, do you recommend doing the surgery? It's like the best thing you ever did? Because for me, it was.
Yes, for sure. You know what? I always tell to the patient that in my experience, doing the surgery was the easiest part. I guess the hardest part for me was like after because your surgeon give you and as company EOC give you all the information that you will be needing before and after surgery. So you have a guide and you know what to do in step 1, step 2, and step 3. But once that you're by yourself, it's like, okay, so starting here, everything is gonna be depending on my choice. You know, what I'm
Exactly.
gonna be choosing. in what way I'm going to go, what I want to do right now.
Yep.
So I think that was is still being
Yeah.
the hard part for me,
Of
like
course.
continuing the track. But of course, was the best thing that I have they
Yeah.
were doing in my life. If like everyone, I guess the only regret that I have is not doing it
Sooner. Yes. Yes. Everyone says that. But that's a really good way of looking at it, Perla. I like that you put it like that. And then Conrad, can you flash? Can you open your I'm not asking you to take your shirt off, but just there we go. Elias Ortiz. You are the face behind EOC Clothing. This is your little your brand. This is what you do. You create all the EOC merchandise. So can you tell us a little bit about that and where can patients buy it because they all want a hoodie?
I guess nobody knew that, right? That you're behind the EOC Clothing.
Mm-hmm. This is the handsome face to the to the brand.
Yeah.
So yeah, where can patients buy them?
All the merchandise from EOC Clothing, you can get it at the hospital or at the hotel and the EOC office. And since probably like 3 years, I think.
Yeah.
3 years. We start the EOC Clothing because like I think it was in this season, like it was kind of cold.
Yeah.
Dr. Ortiz wanted like a sweater with the logo or something from EOC, and I showed it to him. He liked it and told me to offer to the patients. I got the proof to offer to the patients, and a lot of patients like it because it feels like an identity to wear the EOC clothing, and also helps to a lot of patients that, for example, someone bought a hoodie that is large size, and it's like a goal to fit in the hoodie, and it's super. It's like an achievement when it reached to the weight and with the hoodie, and it's like, okay, I made it, and this is one of the goals that they have once they bought a hoodie or just to feel like part of the UC family.
Yeah.
Also.
I love
It's
that.
more than just a souvenir, I guess.
Yeah. Yeah, exactly. And you do hoodies and shirts and that one. You change it up all the time too, and cups and mugs and all sorts of things. So make sure you guys check it out in the hotel EOC office and in your guys' office at the hospital. Where can you just explain where your office is if people are looking for you?
Yes, once that you get into the hospital, the driver is gonna take you to the lobby, and you're gonna see the ladies of the front desk. We're just right behind them, and also in the top of the office is Dr. Elias Ortiz's office. So there's no way to lose. Yeah. We're gonna be here helping in everything you need. Just try to look for the front desk. We're gonna be behind.
And all the EOC clothing merch is in there as well. Well, thank you guys. I won't keep you too much longer because I know there's patients that you got to check in and check out and all that stuff. So I appreciate you. And you two are very camera shy. You always run from me every time I'm in TJ. And I had to do like some convincing you to do this episode. So I really appreciate you guys. You two are the best.
I really love to talk to you, but we don't like camera persons. So we're doing our biggest sport.
But you guys do so good all the time. Every time like I put you on the spot, you always nail it. And you're like, we're so shy. I'm like, but you do good. So
I was really nervous this morning. Since Monday.
Since Monday.
I'm not sure he could have did tonight. Well, last night.
You did fantastic. You guys are the best. So remember these faces. You will meet them once you guys get to Tijuana. So you guys have a good rest of your day, and I will see you next time I'm in TJ.
Sure, for sure.
All right. Here. Awesome. Thanks, you two. Bye.
Bye.
Bye.